So let's talk about reflux or heartburn or GORD or indigestion. So you have a lot of different treatment options available to you at your pharmacy. So let's give you an analogy. If you think about your stomach like a swimming pool, and instead of water being in there, there being acid. So when you use your Mylantus or your Gaviscons, what you're doing is basically throwing something directly into the pool to neutralize that acid. Your next step above that are things like your Zantac. Now they are H2 antagonists. What they do is they actually block the jets that are pushing more acid into the pool. Your next step above that are obviously your Nexiums, your Somax, and your Parates. They are proton pump inhibitors. So what they actually do is they shut the pump down. So the pump actually can't push or pump any more acid into the pool in this situation. So obviously there's a range of things to try. Obviously for pregnant ladies, we can only be trying the Mylanta and the Gaviscon. Anything above that needs to have doctor's consults. And again, if you're getting a burning sensation there and you're trying each of these or a combination of these, and it's only relieving it for a short period of time, you may actually be having the signs of a heart attack. So it's definitely worth talking to your doctor as soon as possible in this case, possibly ringing 000 or getting to your hospital as soon as possible. Again, especially if there's heart disease in the family, it's definitely worth looking at. But in general, obviously you can treat your heartburn or reflux or GORD or indigestion quite successfully at your local pharmacy. So if you don't know what causes your reflux or your heartburn to occur, the best thing to do is actually keep a food diary. Now that food diary, you're going to be able to know what days your heartburn is worse than others, so that you can hopefully find the culprit. Now once you've found the culprit, you can obviously try to avoid that food altogether. If you're going out for a special meal, obviously it's a good idea maybe to take one of these before or prophylactically so that you don't actually get the heartburn at all. If you're getting reflux every day, it is definitely worth keeping your doctor in the loop. You need to be able to talk to them about it because there may obviously be other procedures and things they need to look at and other medications that you can get on prescription to help with your heartburn.